The challenge of employer-sponsored group health insurance is a real problem that's been around for decades now, right? And so the trend line of cost increase for many employers is becoming unsustainable. I do think that what Remodel Health is able to bring to the table is evaluating an alternative solution that could potentially utilize some plans that are more cost-effective. That trend line of increase of the plans we offer through Remodel Health is, much more favorable when you compare it to employer-sponsored group health insurance.
An ICHRA is an alternative to a traditional group health plan where an employer can give pre-tax dollars to employees for employees to then go out and shop for their own individual health plans. And it can be utilized by any size employer. So a group of 2 all the way up to groups of several thousand can leverage an ICHRA.
We're a business. We want to make money like any other business wants to make money. However, at the end of the day, I don't believe that the bottom line is the most important thing for us at Remodel Health.
We are able to save them a lot of money without sacrificing the benefit that's being offered through the solutions that we have, both with Wage Plus and with ICHRA Plus. A lot of times, to be frank, what's at stake is their employees staying or leaving. There are a lot of companies trying to compete with one another in what they offer, and salary is obviously one thing, but health benefits is another huge factor.
And why does Remodel care? I think because it's just the right thing to do. We're in the business of taking care of people, not just treating them as a product, but treating them as individuals and coming alongside them to help them make informed decisions that work for their specific needs.
I remember being able to sit down with a family after we had started with their employer and talked through all these strategies. And this family was pretty nervous when we first sat down. And we went through all the options of what they could do. And at the end of it, they couldn't even believe what I was showing them in a good way. They realized that their total amount that they would have to spend for the year actually went down, and they'd actually be able to completely fill up their health savings account, their HSA. And so they knew for a fact that not only were they paying less, they were actually getting more for the very first time ever from their employer.
I have personally experienced a client's transformation by way of being able to better care for their employees. A lot of companies that we work with or organizations have really strong benefits, but are in a position where they are facing the reality that they can't continue to provide those in the way that they always have. And so it is really, really cool to be able to see them continue to care well, and in many cases, even better for their employees with the health benefits that they offer through the solutions that we provide.
My time with Remodel Health, one of my favorite impact stories that stuck with me was last year. I worked with a group based out of Nebraska. I believe they serve vulnerable children and families. They do really important work. And sometimes with the work that they do, it's emotional, and sometimes there can be secondhand trauma. So when I met with their leadership team, they wanted to ensure that the benefits their employees have serve them. That's the last thing they have to worry about. So they wanted to enrich the benefits. And with that kind of organization where it's faith-based and nonprofit, they don't have a lot of money to play with. So they have a defined budget. So my marching orders were to enrich the benefits for the employees, but stay within budget or even find a way to save the organization money. So I listened to them, took what they wanted to achieve, and went to the drawing table, played with a couple of scenarios, came back to them with the scenarios that I have, and they ultimately settled on a plan where the benefits were enriched for the benefits, for the employees rather. They were able to save money for the employees and also give them HSA dollars, which is a really, really cool benefit. And the organization was able to also come below budget and saved costs from the previous year to the following year. First, they were surprised by how much work I had done. I presented the table, the chart. I was sharing my screen. There were 4 people from the organization on the call. Their first reaction was, wow, you did a lot of work and put a lot of thought into this. You didn't only bring us with one option, but three. And these are all really good options. So they appreciated that. And the CEO actually said, you actually listened to what I said to you during our last meeting. And I was like, of course, that's what we're here to do, to partner with you and listen, help you achieve your objectives. So they appreciated that I listened to what they wanted to achieve. And then I put in the work to make sure that we had the best outcomes.
Okay, so yeah, in early 2023, a specific member reached out to me from one of the organizations that I serve, having difficulty getting a procedure pre-approved. After I connected with the member, spent several phone calls over the course of a couple of days, ended up on a 4-way phone call with the member, the carrier, the provider's office, and another member at the billing office for the provider. Eventually, we were able to get everybody on the same page and get his procedure approved. It was a heart procedure. And when I was on site with that member later in that year for their benefits day, he came up and was just personally very thankful. A difficult situation, but someone that you need someone with this experience to walk through with you and help navigate. So that felt good. Yeah.
I do have an impact story. So last year, I was privileged to be a part of the solution for a larger employer here in Indianapolis. And they were offering a healthcare benefit to their employees that was pretty restrictive in terms of the doctor network. And then also was challenging with the cost to employees to participate in that solution. This employer was large enough that we were able to show up on campus or at their job site during the implementation process. And I was actually sitting next to an employee going through the enrollment platform, through the Remodel Health platform. And when we got to the point where he could see the doctors available to him, and all of his family doctors were in network, whereas before they were not. And then also that he could purchase a plan with a much lower deductible than he had previously been able to access, and the amount of money that he would save and his family would save through that process. He actually said to me, I kind of can't believe this is true, but I'm going to take your word for it. And this will definitely impact my family in a positive way. So really cool experience that I was able to be a part of.
I had done an advisement for a gentleman. It was an organization in Iowa, I believe. He was a little hesitant as to how our solution was going to work for him. We ultimately decided on a plan, got him enrolled. It probably wasn't even 2 months after that. He's calling the customer success rep frantically. His son had gotten in an auto accident, was at the hospital. He did not have his insurance cards, and he wanted to know if we could help him with that. So I got on the phone with him, went to the carrier portal where we could look up his information. I was able to download his card digitally and send it to him within 5 minutes. He was very grateful for that. Everything worked out fine. His son was fine. I think that's one of the things that created Remodel Health. I think the overall concept of putting people first is very much alive at Remodel Health.
Why does Remodel Health care? I think it's a differentiator. It's what sets us apart in the industry.
I do have a daughter that has a significant special need that requires chronic care, continuing ongoing care. So I've always kind of had an appreciation for the importance of healthcare benefits. It's nice to be able to work for an employer that wants to partner with other organizations to provide that same level of care. So for me, it feels good to know that the same level of care I've experienced through Remodel Health's healthcare benefits is also being offered to the people that we're privileged to serve.